Welcome back. My name is Dr. Andrew Grecki, owner of Superior Physical Therapy, and in this segment we're talking about the 3 most common types of hip pain. And when I say types, that does not mean the cause, but what I'm talking about is the diagnoses, okay? So number 1 most common type or most popular diagnosis of hip pain is osteoarthritis. So osteoarthritis is diagnosed using an x-ray. And what the radiologist is looking for is they're measuring the space, the joint space between the head of the femur and the socket of the pelvis, okay? And as we age, we are losing joint space all over our body. And we now know, which we'll talk about later in the show, that studies are indicating that the majority of people are actually walking around with hip osteoarthritis, but they're not in pain. In fact, the study we'll talk about indicates 80% of people over the age of 63 who have no pain also have hip arthritis. And so later I'm going to also help you explore ways and strategies to relieve pain. Even though you have arthritis, there's still a lot of hope. By the way, osteoarthritis in the hip has other names. And so one of the names that I really don't like very much, but it's very popular, is called bone on bone. Not a huge fan of that type or that name, mainly because if you think about it, it's not accurate. So we're measuring joint space on an image to determine whether someone has arthritis in their hip. However, if we were to take the bones and touch them together, the space would be gone. Therefore, there'd be no movement. So it is possible to be bone on bone, but if you're able to move your hip, then the chances are it's not actually bone on bone. Another reason I don't like measuring joint space to determine whether somebody has arthritis is because joint space is changing all the time. It's dependent on your position. So if you're laying down, the joint space is opened up. If you're standing, it's a little bit more compressed because of gravity. And then based on how we're moving and what our feet and our shoes are doing, it changes our joint space all the time. So we know that osteoarthritis is the most common type or diagnosis, but we also know that 80% of 63-year-olds are living with no pain even though they have arthritis. So we really can't come to the conclusion that that's causing pain. Okay, number 2 most common type or diagnosis of hip pain is called hip bursitis. And as you can see on this image here, hip bursitis, or a bursa, is a fluid-filled sac. We actually have them throughout our entire body. Their function is to be between, so a muscle turns into a tendon and the tendon attaches to a bone. And the fluid-filled sac called the bursa is actually underneath the tendon, and it's designed to lubricate that tendon so when it's rubbing on the bone, it doesn't fray the tendon. So it's kind of a cool design if you think about it. But when the tendon rubs too much, there's too much motion and friction in an area, the hip, that bursa starts to get inflamed. So the friction causes inflammation, and then we get bursitis, so inflammation of that fluid-filled sac. Common symptoms of hip bursitis are I have pain in my hip when I lay on my side. So very, very common, yet undetectable on an image. So we're not seeing that on an x-ray, but yet there's a really easy test. The test is actually just, if you can push on the side of your hip and you can find a sore spot, that is hip bursitis. If it's the joint, you're not feeling that by just pushing on it. It's much deeper. Okay, and then finally, the third most common type of hip pain is called a labral tear. And so a labral tear is, if you look at the socket of the hip, so the ball goes in the socket, around that socket there's a cartilage ring. And that cartilage ring is designed to give the hip a deeper socket so that there's more stability in the hip joint, because there's a lot of forces that go through the hip. If that ring gets a tear in it, that again is picked up on an MRI, and then we are labeled that we have a labral tear as the type of hip pain. Again, the problem with the way that we diagnose that is that studies are indicating that a large amount of people who have a labral tear in their hip also have no pain. So a labral tear does not mean that's actually the cause of pain. It just means that we picked it up on an image, we've been diagnosed with it, but 69% of people over the age of 60 have a labral tear in their hip without pain. In fact, I have a labral tear in my hip and I have no pain. So there is hope, and I hope that that makes sense. So we just went over the 3 most common types of hip pain.